Every day, millions of people around the world rely on nurses for care, comfort, and health. But did you know that nursing isn't just female majority? It's one of the most female-dominated occupations on the planet. In fact, women make up an overwhelming share of the global nursing workforce, far more than in most other professions. Let's break down why that is, what the data really shows, and why it matters. Globally, women dominate the nursing profession in a way few other jobs do. According to the World Health Organization, around 85% of nurses worldwide are women. Other international reports estimate that 90% of nurses globally are women, meaning roughly 9 out of every 10 nurses you see are female. When you compare this to other jobs, even in sectors like education or healthcare, overall nursing stands out. For example, nursing and midwifery associate professionals and nurses have a much higher female share than almost all other occupations. So nursing isn't just female majority, it's one of the most heavily female workplaces in the world. There are a few big reasons behind this trend. Caregiving roots. Nursing grew historically out of caregiving roles that were socially assigned to women, especially caregiving in families and communities. Education pathways. Nursing training became one of the early professional routes that women could access, even when other careers were closed to them, opening a path into formal, paid work. Job accessibility and stability. Nursing offers relatively accessible education paths, widespread demand for workers, and often flexible schedules, which can be attractive for women balancing work and family responsibilities. All of these help explain why so many women find nursing both accessible and meaningful as a career. To put it in perspective, in the global health and social workforce, around 67% are women, higher than the average for all jobs. But in nursing and midwifery professions, women dominate to an even greater degree, with 80% or more in the role itself. That's a stark contrast to many other professions. For example, fields like engineering or computer science often have less than 30% female representation. Nursing flips that pattern almost entirely. Even occupations often associated with high female participation, like teaching assistants or childcare workers, don't reach the same female share as nurses. This isn't just a local phenomenon. It's a pattern seen across most countries around the world, from high-income to middle-income nations. The dominance of women in nursing raises deeper questions about how gender roles shape our understanding of work. On one hand, nursing provides essential service and economic stability for millions of women worldwide. On the other hand, the fact that such a critical job is still so gender-skewed suggests that societal expectations about caregiving and women's work remain powerful forces today. Some experts argue that this reflects lingering stereotypes that women are naturally more caring and nurturing, even when research shows that caregiving skills aren't inherently tied to gender. Others point out that men can feel discouraged from entering nursing because of these same stereotypes, reinforcing the imbalance. Even with high numbers of women in nursing, there's also a gendered pay and leadership gap within the profession. In some countries, female nurses earn significantly less than their male counterparts, despite similar qualifications and hours worked. Men in female-dominated professions often earn more, a pattern seen globally in many sectors. And while women make up most of the workforce, they are often underrepresented in senior leadership positions. Nursing directors, hospital administrators, and policy leaders still skew male in many regions. This means that even in a female-dominated profession, women don't always have equal access to the highest paid and highest authority roles. There are signs of change, slow but real. In some places, more men are entering nursing than in past decades. Posts in professional forums estimate that around 10 to 15% of nurses in countries like the US are now men, up from lower percentages in the past. The profession is actively recruiting more diverse candidates to address nursing shortages and diversify perspectives. At the same time, women are also rising in other previously male-dominated careers, including medicine, law, and engineering, which suggests that gender representation in work is becoming more fluid overall. But the overall pattern remains clear. Nursing is still one of the most female-dominated roles in the world, and that imbalance isn't disappearing anytime soon. Understanding why nursing is such a common job for women helps us see broader social patterns, how expectations shape career paths, how gender and work intersect in daily life, and how society values or undervalues caregiving work. Nurses are essential to healthcare, communities, and economies, yet their gender dominance also reflects persistent occupational segregation that economists and policymakers see as a barrier to gender equity. If one of the most important jobs in the world is overwhelmingly done by women, is that a sign of progress in employment, or a reminder of how gender roles still shape our choices and opportunities?